greetings to all. Thank you for inviting me. I am delighted to be here today representing Ukrainian refugee physicians. The ongoing war in Ukraine has led to a significant influx of Ukrainian healthcare professionals seeking refuge abroad. These people bring invaluable expertise and a strong desire to continue their medical career in the UK. However, they encounter numerous obstacles, including language barriers, unfamiliarity with the UK healthcare system, and the complexities of regulatory requirements. Allow me to share a bit of my own story. So I resided in Kharkiv with my two daughters and worked as a consultant rheumatologist before the war broke out. I also had the privilege of serving as a PhD associate professor at one of Ukrainian's top universities for almost 15 years. But when my world turned upside down, and losing everything you once knew and feeling as though the ground has been ripped from beneath your feet it's undescribable feeling, to be honest. I arrived in the UK in May 2022 with nothing but despair waiting heavily upon me. I began to survey my surroundings and explore my options. As you may know, the bureaucracy in this country can be quite daunting. And I was completely overwhelmed. Then I realized that I had to pass numerous exams and spent at least 10 years in training to become a consultant again. And it seemed like an impossible task. One day, I put a post on Facebook and trying to find someone who is the same boat. As a feedback, in a few days, I became an admin of the Ukrainian medical community in Telegram channel. And today, we have more than 1,000 Ukrainian healthcare professionals all around the UK. I met Oksana Lyovichkina and Roman Gregg and began volunteering as a medical coordinator for the Ukrainian Medical Association for the UK. Now, we have subgroups of dentists, nurses, and doctors in our community. And all this time, we have been trying to collaborate with different authorities, such as General Medical Council, Nurse Medical Council, and unfortunately, less successfully with Dentist Medical Council. Also, in 2023, we established a Ukrainian medical charity. We aim to provide vital assistance to Ukrainian refugee physicians as they transition into UK healthcare system and foster their ongoing professional growth, providing vital medical supplies to Ukraine and offering assistance to rebuild Ukrainian healthcare infrastructure. Thankfully, I encountered kind-hearted individuals who went above and beyond to assist me in my own journey. And now I work as an admin for the Lewisham and Greenwich Trust, passed all exams from the first attempt, and got GMC registration. However, I must acknowledge that my case is more than an exception than a rule. Currently, near 1,000 Ukrainian healthcare professionals can be involved in the NHS. Allow me to share some statistics with you. 96% of Ukrainian physicians aspire to obtain GMC registration. However, the journey is slow, with only 12% having passed the English exams and mere 2% having secured GMC registration thus far. The primary barrier remains language proficiency, with achieving the required B2 level proving to be a significant challenge. You may say that 18 months seems like enough time to learn English. However, due to the CFR achieving the B2 level requires 1,300 guided learning hours. Plus, according to Cambridge guidelines, for one guided hour, students need to spend 1.5 hours self-learning. I wouldn't say that my English skills before the war started were abysmal, not at all. Thanks to years of teaching based on European medical and British guidelines, I had a relatively extensive passive vocabulary. However, my speaking and listening abilities were merely at a heuristic level and were absolutely insufficient for the exams. Thankfully, I stumbled upon Review Aid and their constant support and guidelines with English learning courses for me and further for all our Ukrainian medical community were and continue to be invaluable. I would like to point out here that behind all these numbers lie real people, individuals forced to leave their country in search of safety for their families. We never anticipated becoming refugees. Ukrainian medics, and especially women skiers, faced the challenge of balancing English learning, exam preparation with our responsibilities of supporting children and elderly parents. Covering cost of living for someone who has lost everything can indeed be a challenging task. Moreover, the financial burden associated with exams and preparatory courses, despite the GMC discount, can be substantial. In light of all of this, the opportunity to restart the medical support worker program is a beacon of hope. This program offers a remarkable opportunity for us to contribute to the UK healthcare sector and familiarize ourselves with the NHS, especially when our expertise is greatly needed. We all understand that the ongoing war has created a clinical gap in the practice of Ukrainian doctors, and we're trying to find possible solutions to address this gap and help these doctors regain their confidence and competence in their medical practice as soon as possible. By supporting this program, you will play a pivotal role in facilitating the successful integration of Ukrainian refugee physicians into the UK healthcare system. This assistance will not only address workforce shortage, but also enhance patient care across the UK. To ensure a smooth transition for Ukrainian physicians, we kindly request your assistance in connecting us with the relevant teams responsible for supporting refugee healthcare professionals while they obtain GMC registration. On behalf of Ukrainian physicians, I extend heartfelt gratitude to all authorities and all partners for their invaluable support during this challenging time. Every effort have made on our behalf has been an enormous source of motivation, and from the bottom of my heart, thank you.